You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In Podcast by Nurse Junior and Anthony.
You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In Podcast by Nurse Junior
and Nurse Anthony.
Yes, sir. Yes, sir. Episode 22.
Sir.
So this is funny because we're just going through the same thing because we forgot to start the goddamn recorder.
Yeah, that's all good. It's all good.
Like I said before, shout out to the Germans.
Yes,
because
sir.
we got a lot of viewers right now from Germany, Sweden, Norway,
Let's go.
Mexico. I think that episode where we drank the tequila, the numbers are going up.
We'll get some more tequila up in this joint.
Yes,
Don't play.
So shout out to all of y'all that have been supporting, you know what I mean?
Yes, sir. Thank you so much, guys.
Yeah, so make sure y'all like, subscribe, comment, YouTube, all that, Spotify, Apple Music, or Apple Podcasts. But today we got a special guest. I'm going to let him introduce himself.
So I mentioned it twice now.
I
I do find a little bit of a hard time talking about myself, but I got a little bit of the libation to help me out here. Thanks to you guys. So I'm Anthony as well, but I'm a labor and delivery nurse right now. I just hit my 3-year mark on my floor, and that's what I've done since my nursing school graduation, and now I'm currently in women's health nurse practitioner and nurse midwifery MSN program.
Yeah. See, I was saying before, that's something that I'm super interested in because my wife and I, Angela, who we've had on the podcast, we lived in Australia, and over there midwives are huge. So prior to that, I had no knowledge of midwives. Obviously, you hear about it here and there. And over there, for all the prenatal appointments and everything, along with meeting an OB, you also meet a midwife, which is kind of the first time I was introduced to midwifery. And truthfully, if we have any OBs listening, I'm sorry. But I felt like the midwives were way better in terms of like standard of care and just everything that came with that. It made us a lot more comfortable than dealing with the OB, truthfully. And now OBs are great. They're great when you need them. They're there. They're awesome. But yeah, that's something that I find really, really cool. And even when we had our kids in Windsor, we had midwives for both our kids, and they were awesome. Yeah. Awesome. Shout out my girl Ginger. She delivered both my kids.
Yeah. Quite a story, I heard.
You had to be there. You know?
Yeah,
man.
So I met Anthony, this Anthony, at a clinic because I was looking for a placement because I'm also in the MP program as well too.
Right.
And I was looking for weeks, so I stumbled upon the clinic, went there in person to introduce myself and my resume, and that's where I met Anthony and another individual. So we exchanged contacts and kept in touch with him and his journey. And what surprised me and what interested me the most was that you're doing the women's nurse practitioner program, correct? Did I say it right?
Yeah. No, women's health nurse practitioner and then the midwifery.
Okay, yes. So my first question is, why that? Because we're already in a women-driven profession. Now you're going into a women-driven specialty, I would think, right?
Yeah,
would you say?
Heavily.
Yeah, so if you can go into that a little bit, because I'm curious.
That's probably the longest part of the story I'm going to tell here, just because it was so uneasy for me. Even, I don't want to start too early, but even getting into nursing, it was like, I lived in D.C. for a couple of years. I was born and raised in Michigan, but lived in D.C. for a couple of years and met my wife in like the D.C. area because I was working out there.
Yeah,
right.
She was in nursing school, and I was like ready to move back to Michigan, and like, what should I do? And I knew I didn't want to work at a desk anymore because that's what I was already doing. And she talked me into nursing, which I was actually already so uneasy about.
Yeah.
I was in like a field that was a little bit like hyper masculine, and I was raised in like a conservative family, so it was like, dude, nursing, like,
that
ain't for me.
Tell me about it.
But man, she talked me into it because I knew I wanted to be on my feet, and I love working with people, and nursing just fit super well. And then you get into nursing school, you do your clinicals, and I actually did my OB clinicals where I work now.
Oh, wow.
And I was just blown away by like how just wrong I was about everything. You know what I mean?
For sure.
You see stuff in like pop culture, movies, you're like, oh, the water breaks, a baby comes out. Like everything's just like sunshine and roses. Every single pregnancy is just like, whoa, it's a good time.
Oh, for sure.
No complications, it seems like, but
Knock on wood.
yeah, no, for real. Knock on wood, but I remember doing that clinical and just being like, wow, I'm getting a little bit of surgery with the C-sections and like other, we do some other surgeries, some small things.
Yeah.
And, you're getting like borderline ICU care on our unit.
Sure.
We're going to the ICU a lot of times, or like we're transferring care to the ICU and we have to tag along, which is just so interesting. And you're getting, every pregnant person has the same complications as any non-pregnant person. So you're seeing all these complications and just health conditions that you just see such a broad scope. And then you also get that like the fetal care, you're caring about the baby at the same time, which is just so, I don't know, I was just blown away by how detailed and broad the scope of care was. And then at the same time, just like the need for care in that area is like ridiculous, especially in America. And especially, I know you guys talk about this on this podcast, and that's one of the reasons I'm so excited to be on here, like Black America in particular, just like the need for care and like, oh, it's just such a, I don't know what to say, to represent how I feel about it. I mean, seriously, I just have such a passion for like Black maternal morbidity and mortality. Almost every single paper I've done since that OB clinical and like the didactic course has just been like Black maternal morbidity and mortality, infant morbidity and mortality. It's just, there's such a need for it, and I'm so passionate about it. And I'm like super grateful that I got to break into this field a little bit.
So just because on one of our episodes, we kind of touched base on juniors' rotation on a labor and delivery unit. And I guess the difficulties or the challenges that came with being a male nurse on a labor and delivery floor. Like a lot of husbands, for example, didn't want him in the room.
Yeah.
Is that something that you have encountered while you've been working, or even as a student?
Definitely. Especially, I think almost the student role plays more of an aspect than the male role that I've found.
Yeah.
And that's, I still grappled with it. And, especially when you're a student, you're like, dude, is it because I'm a guy? Is it because I'm a student? And I remember actually a midwife that I work with now, still on the same floor, was my like preceptor for the clinical rotation.
Right.
Yeah, I'd be leaving messages. You got to turn in assignments every clinical. It's like you go in, you see the patient, you got to write like a SOAP note or something and like a nursing diagnosis.
Journal.
I'd like enter. At the bottom of the page, I'd be like, Katie, I don't know what's going on. I think I really like this field. Like, is this okay? Am I allowed to like do this? Is this even like a possibility? Am I getting my hopes up just for nothing?
Right.
Because every once in a while you'd meet somebody that'd be like, no, I don't want students, and you're like, is that because I'm a guy?
Yeah.
But no, she reassured me there was already a male nurse on the floor that I work on. So there is one other that I know of that's a male nurse, and it seems like it's largely like a cultural thing when we get rejected, or preference for a female nurse, and it's
For sure.
It's actually so few and far between. It kind of surprises me how, now I'm working in OB triage instead of like the labor and delivery rooms. Mm-hmm. I still work all of it. The floor that we're on, we do the labor and delivery. We do like antepartum care where you're there, complications but you're not delivering, and then we do triage, which is like an OB emergency, an emergency room kind of thing.
Yeah, right.
And in the triage, you're seeing like maybe a couple dozen patients at like the busiest day. So
yeah,
even still, maybe once a month, I'll get a patient that says like, "Hey, I'd prefer a female nurse." Yeah.
See, for me, shocking. It was when I was a student. For me, it was once a week.
Yeah.
You know what I mean? Which is crazy because there's a difference here. So when I was a student, I thought it was because of my race. I thought it was because I was black. Yeah, that a lot of and it wasn't. I don't even think it was the mothers. It was more so the significant others that didn't want me in there. So I thought it was because, my male, I am a male, but at the same time, is it because of the color of my skin? Could that be it? and the demographic was, mainly white individuals, Caucasians.
For sure in Windsor.
So for you, I mean, you said you did your schooling in Michigan?
Yeah, like Metro Detroit.
Yeah.
Right. So I'm sure the demographic, mainly blacks, right?
Yeah.
Or not necessarily?
I think that plays into a lot too, especially now that I'm in those clinical rotations for the MSN program. I'm seeing, different populations. Right now I'm in Dearborn, which is like a majority Middle Eastern population. And like I told you guys, I'm with a male OB, which is a little more reassuring. When I first saw the placement, I was like, ooh, because it is a largely cultural thing to have just female nurses. But, they come to him, they see him as an obstetrician. He has a midwife that's there, so they do prefer to see like the female midwife that's with him. But, when you need it, they're comfortable seeing him. But it is like a population thing for sure.
Yeah, because I feel like for me, whenever a patient would prefer a female and they're like, no, you can't be in here. Typically, it is actually like a Middle Eastern Muslim population that's like women only, and I respect that. Like I get it. Yeah. Even in school, you kind of learn about various religions and what like their needs and wants are. So as soon as the profession started, especially being in the area that we in with such a heavily Middle Eastern population, these are things I expected.
Yeah. Oh, and I've had like encounters with I don't know. I feel like as a nurse, it's definitely easier to like accommodate that. Yeah. When people are saying like, oh, I prefer like a female nurse, it's like, oh, okay, let me like text the charge nurse, let's get you switched over super quick. I've had patients that are saying like, I prefer like females everywhere.
Yeah.
And I push pretty hard to accommodate that even though it goes we're all even or whatever. Yeah, we're all peers, but it goes like above me a little bit in terms of like the obstetrician and pediatric teams and stuff, and even then I push back on that a little bit because I respect the culture for sure. Yeah. I don't want people to feel uncomfortable, especially in like something that's like, I don't know. It's part of what's nice about labor and delivery is that it's healthcare, but it's also an experience at the same time. Yeah. It's not just like, I don't know, people love to say healthy mom, healthy baby.
Yeah.
That's like the bare minimum in my mind,
I agree. So are there any challenges that you face specifically as a male nurse in the field that you didn't really expect?
Yeah, and it's, I feel like it comes more from people who aren't patients. Like you were saying, like patients kind of don't mind. Yeah. It's the significant others sometimes, if it's not a cultural thing, that are like a little bit more like, don't be looking at my wife or my girl.
Of course.
Right.
Or
because you're seeing everything. Yeah. You're seeing all parts.
Like it's worse time in a way. You know what I mean? Yeah, I can't tell you how separate work is from
of course
play.
Of course, yeah, absolutely. And you know what's crazy? Like when I had my kids, I was like, this is crazy, bro. Like
it's a very vulnerable time for the woman. Very vulnerable time.
Yeah. Oh, for real. And I don't know. That's part of it too that got me into it. I mean, it's something you kind of just don't see. I know in like 8th grade or whatever, maybe you got to see like the delivering a baby video, but just doesn't compare to like, man.
Yeah, in person.
I know some people are like a little indifferent to it, but for me, it's like you're in that right delivery, you're getting chills every time. What a special moment,
That's interesting you say that because I can only speak for like my own personal experiences, and I remember when I was a student and you get those textbooks and you can see all the pictures and people are telling you stories and everything. I'm like, yo, I could never do labor and delivery. Never, ever, ever. I was like, I don't even know if I want to be in the room when my kids are born. Like this shit. And I was like, when the placenta comes out, I'm not there. I'm out, Like, and then obviously my first son was being born and I was obviously part of the whole thing. And I was just like, this is crazy in the best way. Like, I was like, this is amazing. And I was like, you know what? I think I could probably do this. Like, you get to see a whole different side of, I guess, women and what they're capable of.
Yeah.
And I don't know if it's because I was in the room with my wife, but I was like, this is amazing. Like, this is being religious. I was like, this is a miracle. Like, I'm watching a miracle happen. And it was, like you said, like chills down my spine, like just a very emotional moment. And I would like to think it wasn't just because it was my kid being born and my girl on on the bed, but the whole experience was pretty crazy.
Yeah.
Like,
You're even seeing a whole different spectrum of healthcare. There's some individuals that have never been in that environment.
Right.
Have never even stepped onto the OB or labor and delivery unit.
absolutely.
So yeah, I guess it is a blessing in a sense to even, have that opportunity to be on the labor and delivery floor. Looking back at it now.
Yeah.
But another question I wanted to ask you: you said you've been a nurse or an RN for 3 years.
Yeah.
Prior to your wife pushing you to get into the program, did you know that you wanted to be in that specific specialty?
Oh, not at all. That's one of the first things I say every time anybody asks me. They're like, "What made you want to do OB?" It's like, bro, I didn't know until I was in the clinical.
Until you were there.
I mean, seriously, from the outside in, it was like I didn't know much about it, and it was like, couldn't be me, just
Yeah.
like so far removed from like the facts of it all.
Absolutely.
Like seriously, just pop culture, and you see that in the patients too, which is crazy.
Yeah.
Even people that are like, right now they're pregnant. It's like their expectations are based off of pop culture for the most part because we like we don't talk about birth like as a community.
Absolutely. You're absolutely right.
But no, it's I had no idea what I was doing before that. I was working a desk job and it was like police officer, but that was 2018 and there were a lot of
Police
things.
officer, is that what you said?
No, I wasn't, but it was like the top choice considering I wanted to
Okay.
be on my feet. I wanted to work with people.
Right.
That was like next top choice, but
So what was the desk job you were doing at the time?
So
you
I
don't
was-
have to say the company. But.
No, you're good. The company was the U.S. Navy. I was
Oh, no
actually,
shit.
Yeah.
Oh, wow.
I was actually working as like a cryptologist technician in the Navy.
Okay. What's a cryptologist?
Gang of Phyllis Caesar. I don't know. That's the first thing that came to my mind. Either that or crypto.
It's like same root word with like crypto, where it's like secret or like encrypted or something like that. There's a couple different like specialties of it in the Navy, but the specific one I was just worked with like radio signals, cell phone signals, like faxes.
Wow.
So I was like literally sitting at a desk all day looking at
Yeah.
like waveforms, like signals.
Oh, my God.
Just it was so not for me.
Yeah.
Like sometimes it was interesting work, but just like I needed to be on my feet.
How long did you do that for?
You do like a 4-year enlistment, so it was about you do like the basic training thing, and then you go to school, and then it was probably about 3 actual years, 4 years total of the enlistment, but three like actual years of like on the job, like doing it.
Wow.
But that's why I met her in DC, because I was working out there just in
Oh,
like
I
some
see.
office,
That
just
makes
like
sense. Okay.
rat race grinding
Yes.
5 days a week, 7 to 3, which is actually sweet for
Yeah.
the military. I'm sure you guys can assume like the military is like a little
Yeah.
brutal on other occupations. I had it made, but it still just wasn't what I wanted to do for another couple decades.
Yeah, absolutely. The rest of your life.
And it's amazing to me how, for me personally, I know a lot of female RNs, and, a high percentage of them are married, and they are pulling in their significant others to get into the profession as well, too,
Oh,
which is amazing to
100%.
see.
Yeah, I can't remember which one of you guys it was, but one of you guys said your wife's a nurse. Was that was
yeah,
you,
yeah,
right?
Yeah. Yeah, she's a peds nurse.
Yeah.
Yeah, so.
It's a good, actually, the way I got in, I think we've talked about this before, is like a mutual friend of ours. At the time, I was in university.
Oh, your roommate or what?
Yeah, it was my roommate, and she was just like, yo, you don't like the program you're in? I mean, kind of similar, like, but mine was my university program, yours was your job, and I was like, man, what am I going to do with a biochem degree? Like, what I'm not going to be a scientist. I don't have the marks to be a doctor, She was like, why don't you try nursing? Because was very intrigued by healthcare. I was like, I never thought of that, because at the time, I didn't know any male nurses. You know what I mean?
Yeah.
I mean, you hear about male nurses in the program, but never knew a male nurse working. So I was like, I'm a big black man, and I was like, this, like, just out there. You know what I'm saying? Like, I can't imagine myself at someone's bedside. And I gave it a shot, and man, like, never looked back.
Yeah.
Crazy.
Yeah, man.
So now that we're on that topic, actually, in OB, do you feel as if there is a bias when it comes to male nurses being hired on to the unit, or what are your thoughts on that?
It's tough. Well, I didn't like fully expand on it, but I feel like some of that, like, not necessarily like discrimination, but some of that hardship you face as like a male in OB comes. I said the patients, like the patients are usually cool with it. The significant others give you some pushback.
Yeah.
It's like the older generation, I think, is like a little more traditional. They're a little more conservative. And sometimes those are the people that are in like manager roles. So I feel like it's fair to say that you could face a little bit. I mean, I was super, super grateful to have like that midwife as my clinical, I forgot what they call it, my clinical instructor.
Yeah, clinical instructor.
Yeah, so that was sweet because she got to put in a word with the manager, and they had already had a male on the unit, and I got to be on my own unit for that clinical, and it just like everything lined up so perfectly for me. But I can't imagine somebody coming in just like cold, putting in an application out of a nursing school where they weren't on that floor, they don't know anybody. Like,
so the connections essentially is what you're saying is really what got you in. From your clinical instructor, and maybe even the male that was already on that floor was pushing for you to get on.
Yeah, I mean, I can't say it for sure, but I just, I overhear it a little bit, or sometimes I bring it up to people that aren't like on my floor, and you hear like, people don't necessarily think that people like males should be in women's health at all. Which
I
is,
disagree.
I mean, I have to disagree.
Oh, but
it's kind of like similar to wanting a black provider. You want somebody that you can relate to be with you, and
right.
It's a tough spot for me. I actually grapple with that probably the most out of anything, talking with male OBs and male nurses and trying to figure out where we stand in that role, because you want to do what's best for the patient, and sometimes they don't think that you're going to be the best for them, and it's like, ooh, where do I fit here, man?
Yeah, absolutely.
Still, should I be here? Is this okay? I deal with that almost every shift. Even when a shift goes great, it's just always in the back of your head, like, is this okay?
Yeah. Well, here's the thing, like, whenever I have any patients that don't want me as a nurse because I'm male, in my mind, I never say this out loud, but I'm like, man, I'm a really good fucking nurse. Like, you are missing out on extraordinary care. You know what I'm saying? And that's like my mindset, I think, as men. And that's not to say, obviously, the women don't, but like, we have quite a few men on our unit now. And the feedback we hear about the male nurses specifically, I think maybe it's because people come to a hospital and expect nurses to always be women, that when they see men doing really good work, they're like, oh, fuck.
It's a little bit of a shock.
Yeah. I'm like, man, the male nurses did a really good job. Like, maybe, we should rethink how we think about this space. You know what I'm saying?
Yeah.
So
I think I see that a lot in feedback, too, is just like, sometimes it'll come up with patients. They're not afraid to say it. They'll be like, whoa.
Yeah.
Like, male nurse, wasn't expecting that.
Yeah.
And then they'll say, like, they've read about it, or, like, in their previous delivery, they had a male nurse or whatever, and they're like, but actually it was, like, a great experience, and you guys were, like, so gentle and kind. And I think that plays into it in a way that, like, we almost don't have that experience, so we're more likely to be like, I don't know how much damage I'm doing here with, like, what I'm saying, or like cervical checks are super sensitive, especially for a lot of people. So it's like, a lot of people say males are just more sensitive with that. Not to say that they all are. I mean, there's definitely male OBs that are like,
oh, bro,
they're super disrespectful.
Oh, brother, I could give a story, but I don't think Ange wants me to. You know what? This is like not too much information that's gonna make you disappointed in me, but like, I
think I know a little bit about it. But yeah.
So, even though we had midwives with our first son, it was kind of a difficult delivery, and so the midwife had to involve an OB in the just in a part of the delivery. And so he came in, did his thing. I thought his bedside manner was horrible. He wasn't. Apart from the friendliness, I felt like he kind of violated my wife. But here's the thing. I work on a surgical unit. His brother is an orthopedic surgeon that I work with. Okay? So I was fairly new to the unit, and I was like, oh, I saw his name, and I was like, do you know so-and-so? He's like, oh, yeah, that's my brother. I was like, oh, the OB? He's like, yeah. I was like, yeah, he fucking sucks. I was like, and he started laughing. I was like, yo, I'm not laughing, bro. Like, yo, your brother needs to work on some shit. And like, he was just kind of like, oh, Like, shit, you know what I'm saying? Like, so this is also where I'm like, man, I love the midwives, and I like there's just a different kind of care that comes with midwives. That like this is why I'll always I think go with midwives, unless obviously there's a complicated pregnancy and OBs have to get involved. I'm obviously never gonna say no, but yeah, man, I've just had not great experience. This few experience I've had with OBs has just not been the greatest.
That's tough. I'll give them a little bit of grace just because they have so much more on their plate in terms of like their worries and their like time constraints, which shouldn't be even like, you know, in an optimal world, it shouldn't even be a concern. That you're like trying to get babies out quicker.
Yeah, exactly.
You know, that you're getting called down to the ER for like some GYN thing at the same time you're trying to deliver a baby.
For sure.
You know, they do have some stuff on their plate, but I don't think that ever excuses like bedside manner.
No, for
specifically.
sure.
Yeah. I mean, that's something like I think people do have a point when they're saying like, not necessarily that male shouldn't be an OB, but like this is a field I think, and for the most part it's true. Like if you're really only in it if you're passionate about it. There's not too many people that I think get into this and they're like, man, I hate my job.
Yeah, absolutely.
Not to say that they don't, but
absolutely. I mean, you guys get to bring life into this world. That's pretty tremendous thing. You know what I'm saying? Like, it's pretty cool.
Yeah, you guys see people coming into the world, whereas other nurses see people leaving.
I know. Yeah. No, people bring that up a lot. Yeah, it's one of the few floors in the hospital where we're celebrating. You know, not that you celebrate kind of like a remission in other floors, and this is like a whole new thing. It's
Absolutely.
not a remission. It's like
Yeah, but you think of like
great.
other units, and I mean, it happens often where you can celebrate that. But your celebration is often, and it is tremendous. Like, you know what I'm saying? Like, it's very cool.
Yeah. So yeah, I guess the next question I wanted to ask you, based on your experience, how many males have you seen working on the OB unit? Like, how many have you seen in your experience or in your timeline of being an RN?
What's crazy is there's still male OBs. It seems like they're almost decreasing though. Just anecdotally, I mean, we have like 6 residents a year, and then OBs have 4 years of residency, so we have 24 residents at a time. Right now we have 1.
Wow.
1 male resident. So maybe, I don't know for sure, but maybe male OBs are also decreasing in quantity. But in terms of male nurses, I know just the one that I work with, and he's actually contingent. So we rarely cross paths now that I'm part-time. He's contingent. I only work weekends, so it's like contingents almost never work weekends.
Absolutely.
You know? They either get canceled or they they try not to schedule themselves on weekends. But.
Do you think that there will be change in the future where there will be more RNs, male RNs getting into that specialty?
I hear about it a little bit more. I feel like there's like 2 things going on. Like it's becoming more acceptable to be a male in OB, but it's also becoming like a more like women empowerment kind of thing where like more women are seeking women in a way.
Yeah.
So I don't know. I think there will be more males just like inherently, but I don't know. I feel like there's like a new wave of kind of like femininity going on where they're into it, which I support. I'm not trying to like
you're just saying a fact.
Because I'm trying to figure out what the resistance is. Because like, let's say there are 10 nurses, one of them's a male, has multiple years of experience,
right,
and the other 9 have maybe minimal to no experience. Who is the manager gonna likely resonate with?
Yeah,
you know what I mean.
That's fair.
Most likely the female.
Yeah,
I don't know. I just feel like, there's got to be change in that specific specialty in some shape or form. But
you know what I think, though, is, you think of nursing as a whole has always been like a female-dominated field. And when you look at on a labor and delivery or like OB or midwifery, I think it's just one of those things where we're going to get there. It's just slow. Like, society, we've always just known, like, labor and delivery nurses, midwives and everything to be women. But I think as this wave of men coming into the field progresses and have that rotation on an OB unit, I think it'll expand.
Yeah. I'm sure it'll follow like kind of the pattern that nursing has seen where it's not like some crazy uptick in males. I mean, it's definitely been getting more males in
do you
nursing
feel-
in general. But
Like, do you feel like when women are families are coming in to like have their baby, and you walk in as the nurse, they're like,
Yeah, what's the first reaction that you're noticing or that you sense?
you know what's crazy? I'm always like on edge for it.
Mm.
No matter how many times I see, like I was saying, I feel like the rate that I see it at is low, where people want a different nurse, but still every single time, no matter, like without fail, I'm walking into a new patient's room, I'm anxious every time.
yeah.
Because I think they're going to have that reaction.
Yeah.
Almost every time, nobody even like bats an eye at it. I mean, it's not even like
Really?
they don't bring it up, they don't say it. That's not even like
Do they sometimes
not even a second thought.
Really?
Do they sometimes question like, who are you? Like, are you the doctor? Or are you?
Oh, even as a student on
Yeah.
an OB floor, I was getting that. Like, I did my, like, you do your, like, capstone, like, your internship. I
Yeah.
actually did that at Grosse Point's birth center, which is, like, much smaller than the family birth center I'm at now. And every day, people were walking in like, oh, you're a resident, you're a doctor, you're something, you're definitely not a male nurse.
Right,
bro.
yeah. I feel like I get that a lot too.
Yeah.
Like, I get that quite a bit, especially like,
From patients, especially.
oh yeah, and you have to like, for me, I'm trying to like put you in the headspace. Like, a lot of the time, like if I'm working a day shift, right? Just imagine it's 7 a.m, lights are still off, you can't see a thing. You see a big black silhouette in your room, and you're just like, I could still see them, and they're just like, who the fuck is in my room right now?
Yeah.
And I turn the light on, and I'm like, yo, hi, my name's Anthony. I'm your nurse today. And they're like, you're my nurse? Yes, motherfucker, I'm your nurse. All right? Like, it's still like a hesitancy. And with a lot of the older population, I find they're like, the first hour or two, they're like, is this guy really my nurse?
Yeah.
And
Am I
sometimes-
getting punked?
Right. And then, like, you know what I get a lot of not a lot, but some questions, some people think I'm the physician as well. Some people will be like, so are you like a student or like the housekeeper? I'm like, no.
I've gotten
All right.
that.
Yes, I'm cleaning up your air because you're dirty, but I am your nurse today.
I was just going to ask that. Do you guys ever feel that in like a opposite direction almost, that because you're black males, like people don't assume you're the physician? They're like, I can't stress it enough that we're all peers. Like,
I understand.
I love
Yeah.
the environmental support that we have, and CNAs and all that. I really feel that we're all peers, and healthcare is like a joint effort. But
I agree.
Do people ever see you as like a less educated role?
I do. Yeah, I've gotten that sometimes. And sometimes it's gotten to the point where they see me as, oh, are you the physician? But it also depends on the person or, the race.
Oh, for
Actually,
sure.
I've noticed. So, yeah, I've seen that. I've gotten that a lot of times. How about you, Ann?
I feel like primarily in like the older population is where I get a lot of those assumptions. Otherwise, I think like a lot of younger patients just know that there's a lot of
It's just
men
cool,
in,
yeah.
you know what I'm saying?
Yeah.
And even though, and that's why for me, and I mean, I know we're taught this in nursing school, we're supposed to introduce ourselves and what we do when we get in the room.
Yeah.
So I like stress it to let them know I am your nurse today.
Yeah.
You know what I'm saying? Like, but yeah, I definitely see it. Like, even when it's not said, I can see it on their faces. Like, this, my nurse. Like, you know what I'm saying? But, yeah.
True.
So I kind of wanted to, like, outside of, like, now you're RN, I want to transition to what you're doing currently, like, with your NP and midwifery. Once you graduate, are you planning on working as an NP in that field as well as a midwife? What's the plan for you?
It's tough because I'm not there yet.
Yeah.
You
How much
kinda
time do you
gotta
have
look at
left?
December of 2025.
Hey,
congrats.
We're almost there, bro.
It's funny because
almost there.
I think I finished.
Less than.
I finished in August of 2025.
Oh man.
Yeah, but we're there, man.
Yeah,
we're
man.
almost there. So yeah, back to his question. Like, do you plan to open up your own clinic? Maybe work in a facility, hospital? What's the plan? Yeah, I'm curious.
There's just, I don't know. I feel like, especially with these like dual programs, there's just so much. Women's health nurse practitioner has like a pretty good overlap with like family nurse practitioner, where I'm not caring for like pediatrics, but
Yeah.
or newborns as a women's health nurse practitioner. But the dual track thing gives me like midwifery care is for infants in their first age, and then women's health, I could care for men at the same time in like a primary care kind of aspect. So I think what I'm focusing on right now, especially being at Georgetown, which is like a private Catholic, you know, I had that GI Bill from the Navy, and it's been lost now that I've gone through the bachelor's program.
Oh, for sure.
So student aid for me has run out. I'm now on to taking out some loans. It's
For sure.
hurting.
Yeah.
So I'm kind of focused on that. The U.S. has a program where if you practice in like underserved populations, you could commit to like 3 years.
Yeah.
You could get up to $180,000 paid back.
Amazing.
Which is huge.
That's a lot of money.
That's what I'm kind of focusing on at first. And, you know, I already mentioned it. That's kind of where my focus is anyways, being in underserved populations. That's where I met Junior, was at the FQHC, which is a federally qualified healthcare center. That's an underserved population where, you know, people with Medicaid, Medicare, without insurance, they're going to get some care, and, you know, it's a little tough. You know, the population is sometimes like exhausting.
Yeah.
You know, even when you're passionate about the work, I feel like I'm comfortable saying this, it's just exhausting work sometimes, because you're doing the legwork of like a social worker.
Oh,
you're
for
doing the work of
sure.
like a primary care physician at the same time,
For
because,
sure.
you know, sometimes being pregnant is what brings them into that office in the first place. And you're like,
Absolutely.
and you got this other stuff going on, like, let me see if I can look some stuff up and help you out with that, because, you know, your transportation's limited, your access to healthcare is just limited in general, so you're working for it. I mean, you'll be there, you said, next semester, so you'll see it.
Yeah,
It's just
I'll be there end of February, if I'm not mistaken. Yeah, so I'm going to see firsthand, and I'll let you know what I...
Dude, it's a great rotation. They're great doctors. You know, they'll take money out of their own pocket to get these people to get to their like imaging ultrasounds, because they're so passionate about the community. And, you know, you'll get the patient that complains like, I've been here for 2 hours, but you know what's nice? After that 2 hours, the doctor comes in the room, they're not leaving until you're like, all right, I'm all set.
Yeah, absolutely.
Satisfied.
You're comfortable.
Every question, every prescription, every imaging order, every referral, sitting in the room writing it out. I mean, they're just so
That's incredible.
passionate. They'll stay in the office until 8 p.m. Like,
That's incredible, man.
it's a beautiful thing to see, but it is a little it's intimidating, just because the workload,
Yeah.
the toll that it takes, like you guys said, like emotionally, mentally.
For sure.
It's a lot, and especially I think when you're passionate about it, it takes that extra toll on you, because you care so much and you want to see that that positive outcome.
Oh, for sure. And like when you're so passionate about it, I feel like you get involved. You want to know what's going on with your patient even after they've left the office. You know what I'm saying? So, yeah, man, that's tough, especially if they're in a difficult situation. You know what I mean?
Yeah, it's kind of nerve-wracking for me, because I feel like I'm not really up to par with that aspect of nursing. Like, I got to do some reviewing before I get into that. But I'm trying to finish my pediatric rotation first before I hop into that. So
Yeah.
I'm excited. I've heard good things about you know, the Dr. Miller in particular. So I'm excited to be there for sure.
It's exciting, man. Long term, I know that. So is long term your goal to also remain in these underserved populations? I mean, I know it's tough, and I know you've already said like the goal right now is get those loans paid off.
Yeah.
But if even for a second you can think about it, long term, do you think this is where you stay?
I think it's kind of like nursing. You just got so many paths you can
Right.
take, and I'm like into that underserved population thing for the loans, and I guess we'll see how the 3 years go. But you know what's nice about being at Georgetown, which is based in DC.
Right.
You know, they're right next to Capitol Hill. They're super focused. Even like the schoolwork, you know, almost every semester they're focusing a little bit on like policy advocacy. I mean, I've always been into politics. I'm super interested in seeing if I can like passively and then maybe at some point like actively get involved more
Wow, that's awesome.
in that. Because, you know, I love being able to help every patient individually, but if I could go on to help in a way that helps, you know, the entire nation or my entire
like a
state
bigger
or a
scale.
county or a city, anything, to
Yeah.
be able to have that impact on a broader scale, like a public health scale, you know, that would be sweet. But, you know, at the same time, you're trying to balance family life. I got a kid now, and, you know, the midwife that I was talking about, that's a clinical instructor that was for me. she does something sweet. She has 2 kids now. She's working just it's like called the hospitalist or a laborist role, where you're almost like a RN schedule. You go in, you're 3 days a week, 12 hours. That's it. You're good.
So do you see yourself also delivering, like, once you're working?
At a minimum, I'd love to keep up the skills. I mean, we'll see where, like, the employment can take me in terms of that, like, student loan repayment. But,
Right.
If I was, like, at a VA only doing women's health, nurse practitioner stuff,
The VA is a sweet gig, man.
I know.
We had a
an
VA
episode,
nurse,
which is actually coming out in 2 weeks. Yeah.
All right.
Yeah, so I'll send you the link to that when that comes up. But yeah, the VA is a sweet gig, man.
Yeah.
That's being a veteran. Actually, the nursing school I went to, Wayne State in Detroit,
Yeah.
and a couple other universities in the area, they have this, like, veterans accelerated degree. I didn't even need an initial bachelor's degree, but I got to go into this accelerated program for veterans. It was just
Wow.
18 months for a bachelor's in nursing.
That's
which
incredible.
is super sweet deal. If any veterans are listening, I mean, look into your area and see if any universities offer it, because a couple around here doing it's just a sweet gig. I mean, I had no healthcare experience, not a bachelor's degree, and I got to knock it out in 18 months. I mean, you still need the prerequisites.
Of
They're not
course.
just letting
Of
you
course,
in,
it's
you
still
know,
university. Yeah, absolutely.
between just kicking out the prerequisites and getting it over, it still took me about 3 years. But that was sweet. And then, you get those connections at the VA by being a veteran, and the benefits. It's one of those last places in healthcare where you're going to get retirement benefits, and, they, without a union, without state mandates, will have, nurse to patient ratios, which is a huge hot topic right now for nursing.
Right.
So
What, actually, speaking of that, what, like, on an OB unit right now, labor and delivery, what are the ratios for you guys?
you can see them from, like, ACOG, which is, like, our like governing body of, like, guidelines. Depending on, like, the acuity of the patient, what dilation, what stage of labor that they're at, they'll tell you it's almost always 1-to-1.
Okay, yeah.
Which is sweet. You have a patient in active labor, you have a patient on Pitocin to help, like, get the labor going, which is like considered a risky medication just because of, like,
what could happen.
You could stress out the fetus by putting, a body into labor.
Right.
You don't know what's going to happen too soon. But it's almost always 1-to-1. And another thing I'm super grateful for, I got to do my clinical on my floor. It's this high risk unit, and we got great staffing, which is sweet. So we're getting our breaks most nights,
That's
and it's sweet because there's Harper Hutzel Hospital downtown in Detroit, which is like high risk and high risk population, and it's just like a lot of nurses come from there, and you hear the stories, and you're like, dude, the population needs it, but I feel for the people leaving because it's like you gotta look out for yourself too.
For sure.
You're going without a break, and you're caring for these patients, and you got like 3 patients at once that like are considered 1-to-1 patients.
Oh, man.
It's unsafe. So
Yeah,
That's my thing, too. Oh, for sure. My thing is, like, take care of yourself, man.
Yeah.
Because if you can't take care of yourself, you can't take care of
Others.
people. You know what I'm saying? Like, and that's across the board, whether you're in a relationship, whether you're a nurse, whether you're a parent, like, you have to take care of yourself, man.
Yeah.
Okay.
So one other question I wanted to ask you was, have you ever thought about dabbling into travel nursing?
Oh,
Especially when you become an NP, I feel like that's something that may...
by the time I graduated, I mean, dude, I went to school during COVID. I graduated in 2021, so it was like peak travel nursing.
Yeah,
Like,
absolutely. Yes, it was, Junior.
What a time to be alive. Some people didn't really do a lot with their money. I mean, they've done a lot. They've spent it. But, thankfully, I had the knowledge to, invest in whatever the case may be. So,
yeah.
But yeah.
Me personally, I never got to do it. I never felt comfortable with it. It was like I wanted to get a year on my floor, and I think being in the high-risk floor played into that. I know a lot of nurses now that are in OB that like haven't been on high-risk floors and like traveled, and they were like, it's great. Dude, you go to like some of these rural hospitals, you're not seeing like these crazy complications that make you feel so uneasy as a new grad. I wanted my whole first year done, but by the time I was at a year, I had a kid, and it was like, all right, we're not traveling.
Yeah.
Like I got to stick around and. There's local travel contracts that a lot of people I actually work with.
Yeah,
right.
Just,
I'm not even going to lie to you. I think during the pandemic, OB nurses were getting paid the most at one point.
Really?
There was a time where they needed OB nurses at an abundance.
Really?
I'm talking, they were getting paid like maybe $140 an hour.
It's
That's
great.
how much they were needed.
I mean, I looked into it so much that I still am getting calls and texts from like, you know,
Like
the
recruiters
healthcare
and
companies
stuff.
that are like,
Yeah.
OB position in California, like, you know, $1,400 a week.
Oh
like, get out
my
here.
God, yeah.
Yeah.
Well, is that something so here's, because obviously you're in a unique situation with you being a nurse as well as your wife. And that's the situation I'm in. Something we've talked about is potentially both doing a travel contract to the same place. And our kids are young enough that they're not in school. So it's just making sure like one's not working and one is working to at least watch the kids and then just maximize how much we can make.
Yeah. No,
Do you guys want more kids? That's another thing. Like, you know, there's a lot of
we do
factors.
want one more kid, and then just, you know, I think we're just both tired, bro. You know what I mean? She finished grad school. Like, she was in grad school, so she was a NICU nurse for 3 years.
Yeah.
Went back to grad school for like a non-bedside thing. She went for leadership, analytics, and innovation, which is like everything but bedside.
Yeah, right.
So she went into a patient safety specialist role, and she actually graduated in December of 22. Our kid was born in October of 22. So
Wow.
same thing. Like, she was in grad school, was pregnant, just like, I'm sure she was tired. Then the first year, you know, it was exhausting.
Sure.
And then I was like, yeah, it's time for me to go to grad school.
Yeah.
Tired.
Exhausted.
So I don't think we're like super. We were never at a point where we were like, let's pick up an extra shift or anything. We're like, let's pay for the daycare.
Let's sleep.
Let's like,
Let's try to sleep where we can.
Any extra time is like cleaning the house, sleeping.
Yeah, that's how it is. I feel like with young kids, man.
Yeah.
It's tough. I'm tired right now. I can fall asleep right now. I'm just sleep right now.
I took a nap before I came.
Yeah, that's what I'm saying. Yeah. Oh man.
Jeez. Yeah, I think travel nursing with OB is a big thing, especially. So I'm not sure if I told you, I did a travel assignment in Alaska for a year.
Well, I heard that in the podcast, which is sweet.
So I think if you were to take your talents and your NP out there, oh my God, they need
Be LeBron. Take your talents over there.
Not only do I know a midwife that was in Alaska and loved it because she was working with that native population that you were talking about, I know another midwife student that's going to U of M that's actually going there right now. Like this week, she's going there for
to Alaska.
Yeah, for her clinical rotation.
Oh, that's cool.
What?
There's a need out there, man.
There is from what you said, there's a huge
For a placement, though, that's amazing.
I know.
And she goes to U of M?
Yeah.
Wow.
So she's flying out there and, living out there for a couple weeks and seeing how it goes. And then if it goes well, she could do the same thing as that midwife that I know that, does the couple of years, gets the loans repaid.
Yeah.
It's an underserved population, even if it's not, people think like urban areas only.
Yeah, right.
It's rural areas.
Oh,
it's
for
places
sure.
like Alaska. So.
Well, because I think too, like if you're in a rural area and something catastrophic happens, like let's say, I don't know, as an example, like delivering mom hemorrhages, and they don't have the resources to take care of that, what do you do?
Yeah, out there, typically, so at the hospital that I worked at, it was a small village, actually. I wouldn't say a village, small town, but it was considered as a village. The labor and delivery unit, it was only 2 rooms.
Wow.
Yeah, that's how small it was. And most of the mothers had the right to say, well, I don't want to give birth here. I actually want to get medevac and fly over to Anchorage, which is the main city of Alaska, and give birth there. A lot of, especially when you're high risk as well too, they don't even take the chance of delivering the baby at the facility that we're at. We just get the private jet or I don't know if it's a private jet. I'm lying. I don't know if it's a private jet, but it's a plane.
I don't think they're a village if they got a private jet.
No. It's one of the, listen, where I was at was probably one of the richest towns of the U.S., but it didn't look like it.
Really?
Yeah, I'm not going to say it on here, but I'm going to be sending the name, and then you can do some research. But that place made money.
Really?
They just didn't show it.
Yeah.
But they'll rev up the plane, and they'll fly you to the city, which is like about, I want to say 3-4 hours away, and then you'll give birth there.
Wow.
Sweet.
Yeah, for the most part. But yeah, only two rooms, and that's it. There's also a situation where like the education as well, the aspect of education is lacking there. Anywhere, I would imagine. But there was an instance where one night a mother came in and she was experiencing like stomach pain. I think she was bleeding. And it got to the point where, the doctor did an assessment and goes, ma'am, did you know that you're pregnant? And she's like, what? I'm pregnant? There's no way. Mm-hmm. I've been smoking. I've been drinking. And I'm like, and I'm standing there like, yo, what? You been what, ma'am?
That is funny.
At that point, they're like, no. You're going in labor. We need to deliver this baby right now.
Wow.
Yeah. She goes, no, you can't. I'm high right now.
Oh,
I can't.
God.
I'm like, no. True story.
That is wild.
They delivered a baby. Everything was good. Obviously, they didn't, they had to separate the two because you can't.
Nah, you can't.
She was not in the right mental state at that point. So, but there's situations like that where women come in and they just don't know that they're pregnant. Whether it's 6 months, 7, 8, 9, doesn't matter. Have you ever seen a situation like that?
In terms of like the not knowing that they're pregnant, it happens like fairly often. Usually at like lower
In the early stages,
yeah,
right?
Usually like 20-something weeks is like a late to prenatal care like surprise. That's not like super uncommon.
Yeah.
I mean it's a little bit like, whoa, dude, you didn't know? Like,
Yeah.
no, every once in a while we'll get somebody that same thing shows up to the ER and it's like, I'm bleeding and my stomach hurts. And it's like, oh, dude, you got a whole 39-week baby.
Oh my God.
It's time to go to OB.
You know what?
You're surprised, dude. You're
actually
40-something years old. Like, it's time to have another kid.
Yeah,
Even though your oldest or your youngest is like 14.
Old. Yeah, that's right.
Like, damn.
I knew a girl that was a hooper, and she was just hooping one day, whatever. On the court, water broke.
Get the hell out of
She had
here.
no idea she was pregnant. No clue. She had no clue. And then she was like, what the fuck? Like, what is this, And so, obviously, like, she starts getting, like, the cramp, like, the pain, the cramping, all this stuff. So she goes to the hospital, and they're like, you are in labor right now. She's like, labor? I'm not pregnant. They're like, yeah, you're pregnant.
You're pregnant.
Yeah, and she had her baby. And she was like, and I guess she just thought, like, when I just wasn't working out enough, not, like, working hard on the court enough. She just was gaining weight, and she didn't realize. And I saw her, like, did not look like a pregnant girl, but delivered a healthy baby. No clue. Yeah.
All right. You were talking about somebody coming in, a little high. We had this patient one time. I was telling you guys I work in OB triage, which is, like, separate from the emergency department. We're way on the other side of the hospital, which is inconvenient from the ER. So we had this lady. We get a call from the charge nurse. She's like, yo, we got a patient coming in. She just showed up at the ER. She said she hit her stomach with the car door. She, like, wants to get the baby checked out. She's, like, 36 weeks maybe. Oh, my God. Like, oh, all right. Like, send her a whatever car door hit. Can't be too bad. I'm next up for a patient. That's kind of how we do it. We just rotate.
Yeah.
We put her in the room. I walk in. Same thing. It's like, I'm Anthony. I'll be your nurse while you're out here in triage, whatever. She's in the bathroom. We have bathrooms in some of our rooms.
Yeah.
So I'm like, all right, sweet. I'll come back. Like, don't stress it. I'll just be back in a second. Went back to, like, the main triage area. Like, I don't know. Didn't even sit down. I think I just shuffled some paperwork and whatever.
Yeah.
Showed back up in the room. Opened the door. She's just, like, immediately like, where did you go? We were looking for you. We're so stressed out. Like, what is going on? Why did you leave us? Like, what's your name? I'm about to report you. Who's your manager?
What?
Oh, my
I was
God.
like, yo, what is going on? Like, all right. Like, she's, like, walking towards me as I'm walking backwards out of the door.
Wow.
Like, aggressive.
Yeah.
Bro. And she has her significant other with her partner. Whoever,
And he's acting the same as well?
He's cool, bro.
Oh, okay.
He's sweet. But she's freaking out. She's walking towards me. I walk out of the door. I'm back out in the hallway. I'm going back towards the main triage. Like, let me get you a different nurse. Like, told her my name. I was like, report me, bro. It's cool. Like,
Yeah.
All right.
Nothing happened here.
Yeah.
By the time I got, like, out into, like, the lobby of OB, I was like, you need to go back to your room and sit down, bro. This is too much. Like, this is too much. And I went back to triage. I was like, hey, I talked to another nurse. I was like, you got to take this patient. I don't know what happened. Like, she was in the bathroom, and, maybe she looked for me. Like, she opened the door when she was done, didn't see me, and was like, she's upset.
Yeah.
Somebody else has to go take care of her. She walked in. The nursing station is destroyed, bro. She destroyed the monitors, destroyed the computer, like, punched them out, ripped them off.
What?
Fucked them up. Turns out, dude, this other nurse, like, built a rapport with her, like, started talking to her. She never hit her stomach with the car door, dude. We drew a blood alcohol, 0.2.
Oh my God.
She's blitzed, bro. She was checking on the baby, which is like, that's another thing where it's like tough population, bro. Like, respect for coming in and checking on your baby, even though, like, you were struggling with alcoholism or whatever. But, like, dude, she was freaking out on me.
Crap.
Yeah, dude, nuts.
Wait, what is the significant other doing during this?
He was sweet the whole time. The other nurse walked in and was like, did she do this? Like, what's up with this computer station over here? And he was like, yeah, that was her.
And that's where the education doesn't.
Education? What education? Like, how do you know?
as a husband, you know that your wife is suffering from drinking. You know what I mean? So it's like nothing clicked in you to be like, wifey, what are you doing?
Yeah, okay.
You know what I mean? That's what I mean.
Yeah. No, I had the same reaction at first. When you're in it, you're like, bro, this is nuts. You're drinking. Like, what is wrong with you? And then you take a step back and you're like, there's a reason that you came in and said your car door hit your stomach. Like, there's a stigma behind it. Like, all right, you got alcohol. Like, it's a disease. You know, you got to take a step back sometimes, take a deep breath and be like, it's a disease. This is a thing you're dealing with. Like, let's do the best for you and the baby. And, you know.
And she's at 36 weeks at this point.
Something like that. Third trimester. She came in a couple weeks later. I'll never forget her name. I'm not going to say it.
Of course.
Even now, I remember her name. And I remember her being there one day when I was there, actually in there to deliver the baby. And I was like, absolutely not. If anybody needs any help, I'm not going to that room.
Yeah, 100%.
You know, I was like, no chance.
Yo, honestly, like, on the real, like, yeah, I'm in that situation. I'm professional. But in reality, I'm looking at her husband. I'm like, what the fuck are you doing?
That's what I'm saying.
What are you doing here? Because you play a role here.
Big
you,
time.
Like, you need to be more responsible. You seem like you're level-headed. Control your lady a little bit.
Like, she left behind a Solo cup. I mean, it was filled. We sniffed it. It's just straight up like wine.
And when
like
I say that, I don't like.
you know?
I understand that alcoholism, like we said, is a disease. But you can't be. You can't just let your girl destroy shit and then think that all is sweet. Like, that's not cool.
Oh my!
That is a wild story.
Yeah, dude. So we never charged her with a crime, but the police ended up coming like a week later to take our like firsthand account. Like, we wrote a report on it. It was a whole thing because she just destroyed like, I don't know, probably a couple hundred, maybe $1,000 worth of property.
100%.
Crazy.
So how's the baby? Is the baby okay? Like,
Did she come back?
It was one of the reasons I got into, you know, advanced practice is I wanted that continuity, because you see people like intrapartum or like perinatal where it's like you see them a little bit while they're pregnant. If they come into triage, you see them for the delivery, you know, they're off to the postpartum floor. Whatever happens, you know, you don't really see it. And same thing with her. You know, she came in, she delivered, you know, I don't know if the baby had like fetal alcohol syndrome or what. You know, I don't know how deep that went or if that was like a one-off, you know, thing. She just had a little bender, but I don't know what happened, but
2 point something is a pretty decent bender, bro. Like that.
point two.
Pregnant or not, like you know, like damn.
Yeah, it's the legal limit in America. I think it's like 0.8.
Yeah, I think that's ours too.
wow.
Yeah.
I know there's been situations on the labor and delivery unit where, you know, high risk or safety concerns may arise where, whether it's the mother, a friend, or even the baby daddy or husband or whoever it may be, may cause a situation or a scene on the unit. Have you ever seen multiple occasions of that? And I asked that because I remember a friend was telling me about a situation where it was a female and a male. She was about to, you know, go into labor eventually, and then he went out the room. The nurse was in there, and she was wondering, you know, where the hell did this guy go? Like, you know, she's actively in labor right now, and we need this guy to be in here to, you know, to support.
Yeah.
So she steps out, tries to find this guy, and he's coming out of another room.
Oh, no way.
And he's like, oh, no, it's all good. This one's mine, too.
Oh, you told me this. I remember you telling this story.
So this guy had a double header. he had one lady going in labor and a double header. Since you're talking basketball, water breaking on the court, he had a double header, a back to back.
Oh my God, like Drake.
Yeah, like Drake. One lady in this room, another lady in another room, both actively going in labor.
Was his name Nick?
Can it? Probably.
You know?
At that rate, shoot. But yeah, he had two. He had two kids that day.
Oh, yeah,
And I can only imagine the two baby mamas realizing that they're, you know,
right next door to each other.
Yeah, they're right next door to each other.
Hearing each other. Yeah.
Oh my God,
That's crazy.
So that's one crazy story that I can share with labor and delivery. But
I feel like I don't have like a standout social story. I mean, I don't know if it happens so frequently. They're like diluted. All the time. Especially like post-COVID, like visitor restrictions are always changing. So it's always like, you know, a grandma or a grandpa or an aunt or a sister or somebody's always trying to like get back. And, you know, we call security every once in a while just because things get rowdy or, you know, in the room, it's usually pretty tame.
Yeah.
We still, it's like weird, crazy stuff's going on that like you talk about at the moment, but nothing's really standing out right now in terms of like just a visitor who was just like out of pocket.
Fair enough. But you mentioned something interesting. So I know in the ER, actually not even in the ER. Does the ER have security?
Oh yeah.
They're not like physically there.
Oh
though.
yeah.
They're there.
Oh yeah. They're
Okay,
there.
so the ER, they're physically there. Psych, I know they gotta physically be there as well
absolutely.
too. I would think another specialty or another unit would be the labor and delivery. Because even back in the day, I've heard of situations where if it's not other mothers, it's random individuals just badging in or coming in and stealing babies.
Oh
Yeah.
my God.
Have you heard of that, Ant?
Oh, you kind of hear about it, but I don't think I've ever. There's anything. Like that at our
Yeah, there
hospital.
have been situations where back in the day, I'm still currently right now probably they steal babies.
Yeah, dude. I mean, it's super, super rare, and it's like there's like triple checking now. You got
for
you got
sure.
wristbands on the baby.
Oh,
you
for
got
sure.
like these alarms on the babies. If they leave like the unit, it starts screaming. But we definitely, nothing's standing out to me to talk about. But in general, I mean, you'll come in, there will be like a new picture on the wall. It's like, if you see this guy, report him to security. Because it's like
Lord.
somebody who's 30-something weeks, they got a baby daddy that's, like abusive.
Oh, I see.
Yeah.
There was just a couple weeks ago, we had like I think he was EVS, like environmental services. He was like not supposed to be on our unit, but somehow he was getting in and was like being weird. So he was like banned. He still works for the system. But
What?
his post was up, dude. It's like, don't let this guy come clean the floors.
But he still
How
works
do
in
you
the
let him
facility.
work there?
Because he was wearing like, I think typically EVS is wearing like a different, labor
Yeah, they wear like a
scrubs.
different type of color scrubs. Yeah.
Yeah.
But it's tough because labor and delivery is all like surgical scrubs, just in case we ever have to go in. Even
Right,
the EVS
yes.
that works on our floor, they're in surgical scrubs because they're cleaning the ORs.
Right.
So this dude was wearing surgical scrubs and he was like posing as other roles,
Right.
bro, and like going into rooms and being weird. Then they just put up a poster and was like, don't let this guy in.
How do you let this dude work? Like, that is a potential lawsuit waiting to happen.
That's the reason why they're not allowing males to be working on
Bro,
labor
this is
delivery.
it, bro.
Guys like him.
We're fucking things up.
It's tough. I'll touch on it real quick. I do want to like open that door for other guys to come in and like work in the space. But
Of course.
Like, yeah, dude, you gotta know it's kind of like a sacred space to be
Oh,
in.
for
You-
sure.
You can't be coming in like I'm just trying to get the paycheck.
Oh, no.
Like making jokes. I'm super conscious of the things that I
Yeah.
say because I know the space that I'm in.
Well, I feel like primarily for guys, if you're going to go into like OB, labor delivery, you ain't doing it for just a paycheck. Bro.
Yeah.
You know what I'm saying? Like, you can go to other units and get paid just as
100%.
well. Like, it's a very, like you said, like a sacred, vulnerable environment. I mean, any unit is, I guess, for someone. But it's just different when you're talking about women having their babies or like obviously you get things like stillbirths and things like that. Like, you're in a very, very tough environment. You can't just be like, it ain't just a paycheck. I mean, I know we touched base on like there's good travel opportunities, but it's a different space, bro.
You got to know your stuff. You got to be attentive. You can't just be there to be there.
No,
You know what I
it's a
mean?
very, very different space.
Because when you're in the moment and in the action, you got to know your stuff.
Yeah, for sure. Have you ever delivered a baby? Like,
No,
like
no.
OB's not available. This baby's coming. Let's go.
A lot of labor and delivery nurses get that eventually.
Oh, yeah?
The patients say something like, oh, the baby's coming. So far, I've been fortunate and like proactive enough to be like, I'm pretty on edge. Like if
Yeah.
you say something like that, it's like,
Yeah.
And we have, like I was saying, we have residents on our floor. Other like hospitals that are a little bit smaller, the OBs won't be in the house until it's closer to delivery.
Yeah.
Even though they should always have like a general OB in the hospital that's like associated with the hospital, not necessarily like the practice. But no, for us it's super simple. I mean, even for medications and like requests for orders and stuff, I'm fortunate to be a nurse that just gets to pick up the phone, hit a couple buttons, and say like, "Give me some Zofran. Come to the room. Come."
Yeah.
Assess this. It's super simple. There's a resident, a couple steps down the hall, and it's. We're responsive with our emergency buttons too. Not that I've hit that once, but not for a delivery. So I've never had to do one myself. So
Do you think once you're done your program, because I mean, for us like midwives, are able to make house calls? Do you think especially working in like underprivileged communities, do you think that's something you would be interested in? Being able to make house calls and go see families in their homes?
That's something I just wrote about in my Canvas.
Oh, yeah?
It was like, what in your area is like a barrier to care? And I wrote, Detroit is so ironically, like transportation is a barrier in Detroit, which is so dumb because it's a major city.
Absolutely.
But it's so focused on cars, and the suburbs are so focused on keeping public transportation out because they just don't,
Really?
They don't, yeah. I mean, it's been up a couple of times where it's like, a subway system or a train system. And Detroit has like, like a metro system that doesn't go anywhere.
Right.
But to expand it to the suburbs would be huge for public transportation.
Yeah.
And it gets voted down every time. People don't want like the Detroit population to come out to the suburbs.
Really?
So
That's
people
surprising.
have this. It inhibits healthcare and
Yeah.
education.
Absolutely.
Big
Detroit
time.
public schools. Your kid has to take a bus to school. It's inhibiting your ability to work and your ability for your kid. I mean, that's like my soapbox, dude. I think it's so crazy that Detroit has a
I'm shocked.
transportation issue. Yeah.
I'm actually super shocked by that.
So that's actually what I wrote about just a couple days ago. It was like, what can you do to help, care in your area? And I was like, Detroit has like this transportation issue. Like people rely on public buses or private transportation that's like unreliable because, when you're at an income bracket that can't afford a reliable vehicle,
Right.
every day's a gamble. If you're going to get in
Absolutely.
your
Big
car
time.
and drive it to work, drive your kid to school, get to a
100%.
grocery store. And I wrote like, house calls, which to be honest makes me uneasy. Even like, outside of OB, like I know a couple of people that are like home health nurses that do like wound care and stuff. And it's like, dude,
tough.
you're pulling up to a rando house,
Yeah.
walking inside.
Big risk.
You don't know what's in
Yeah,
there.
let me be clear. I will never do.
Not for me.
I'll never be a home care nurse. I can
No.
never do it
I
personally.
support it so much.
It's
but-
needed.
Yeah.
I just don't think I could do it.
Yeah, kudos to the home healthcare nurses out there because I've heard some stories.
Yeah.
Where they walk in and it's a goddamn trap house.
100%.
You know what I mean?
But that I feel like is like that would be the least of my worries, truthfully. Like, because here's the thing: I know everybody lives different, and you get a lot of people in hospital beds that are not really very clean, and we've had instances, not necessarily on my unit since I've been there, but you hear about instances where patients come in and then they bring bed bugs when they come in. You know what I'm saying?
Yeah.
Like there are some people that just aren't very clean. However, on top of that, I just personally, kind of going back to what we were talking about, when I pull up to your bed and you're seeing this big black dude come in and you're surprised and you're uncomfortable, and now imagine that in your house. I don't want to be in somebody's house and then feel uncomfortable, and now I'm on my tippy toes or walking on eggshells and hoping that when I leave this, there isn't a situation that arrives where has my name involved.
Yeah.
You know what I'm saying?
For sure.
So that's a big concern of mine.
I'm sure it's super rare, like so rare that it's almost like not worth worrying about. But you see it in the news, man. I'm sure, what was it, like 2021, 2022? You remember people were like pulling into driveways just to like back out and turn the other way. They were getting shot at.
Oh,
Like,
yeah,
you know what I mean?
absolutely.
Like,
Yeah.
keep me out of other people's business.
No, yeah.
Big time.
That's not for the space for me, bro.
Yeah.
It's not.
Yeah. But the next question I wanted to ask you was, I'm not sure if y'all heard about in the news about that NICU nurse that was breaking the joints of babies in the hospital.
Wait, so, because we kind of touched on this, was it specifically black babies?
That's what they said at
Yeah,
first.
it was
But-
like a pattern that it was.
Yeah, it was
Really?
a pattern, yeah. But then I think they did a deep dive research back in the day, and then they saw that, it wasn't only just black babies, it was other races involved as well, too.
Crazy, man.
Yeah,
Like-
insane.
What possessed? Do they know why she wanted to do this?
No clue. And I think she's been a nurse for about maybe 3-4 years prior to them learning about
So
it.
he graduated with her.
Went to the same school and everything. But I think, and to add on to that, I think this wasn't her first rodeo doing this. I think the hospital or facility knew about it.
Yeah.
They put her on leave for a bit, brought her back, and then the situation still continued to happen. And then,
So this is what I don't understand. Okay, and this kind of touches base on the environmental service worker. Like, when people show this pattern of behavior that is obviously detrimental to the people we're supposed to be serving, how do you keep them around? Like, how can she just go on leave and come back and think that she wouldn't be breaking legs.
I think what it comes down to is it was maybe an assumption. They weren't too sure if it was her. Because,
Okay.
I mean, they don't want to point the blame and say,
Sure.
oh, we know it's you.
Sure.
But they wanted to maybe suspend her for a bit and see if the situation still occurred and was happening. But even so, I think at that second time when they did bring her back and it was happening, yeah, I think they knew at that point.
See, I know it's tough because from like an employer standpoint, you can't just fire someone without cause because then you're looking at a lawsuit. But then could you imagine as a parent, you find out that this lady's breaking your kid's joints, legs, whatever it may be, and then you're like, we've had this problem before. Hold the fuck up.
Yes.
So you've had this problem and you
Y'all
guys
didn't
did not-
address it.
No, like how do you
It's a new Pandora's box at that point.
Oh, my
The lawsuit
Lord.
that you might have faced from firing her initially, now you're facing dozens more.
100%.
So it's like
Because
then-
now, let's say even if, like, what happens if you were a parent, like, let's say your kid happened to have some sort of, like, disease or something where they, like, have brittle bones, and then they broke their legs. And then this happened to be the nurse around.
Yeah,
And
you're
he's
reading
just
the
like,
article,
well,
and it's
you
the
know,
same
like,
hospital.
I remember that woman.
She was in our videos. She helped give birth to my baby. Like, you know what I mean? Like,
Yeah.
that's crazy to think of. So, I don't know, man. So, I think she's in jail right now on bond.
so.
Yeah, I would hope so. But
So what do you think about your friend breaking bones, bro? It's crazy.
It is crazy, dude. There's every once in a while you get a story that comes out like this where it's like some healthcare worker is like injecting people with like tap water. They're like you guys had in the last episode.
yes,
like
yeah.
diverting fentanyl.
Yes.
Sucking up some tap water in the
Absolutely.
syringe, just like killing patients, dude.
Yeah.
They're doing something just absolutely like inconceivable. And yeah, it's nuts to. I feel like the NICU is like especially a sensitive population.
Very
You're getting like the
sensitive.
tiniest babies,
the
it's-
innocence.
Yeah, dude. Even if you're like, I don't know. Even in my mind, I just can't even like wrap my head around it. Even if you're like a straight up racist individual, like you're like,
Yeah.
dude, fuck these black babies.
Yeah.
Like, dude, they don't even have a chance to be like what you don't want them to be.
Absolutely.
Right.
What are you doing?
I agree.
Yeah,
like, I
bro.
couldn't agree more. Oh, man, that's wild.
That's
bro.
true, man. Yeah, I can't even imagine like a villain like the Joker wouldn't even dare to do something
bro.
like
Yeah,
that.
dude, that's like that's straight up evil. That's
100%.
like, it's not like you're a bad person. You're a sick individual to be doing some shit
Absolutely,
like
because
that.
here's the thing. What's crazy, like, as fucked up as it is, I could understand somebody, honestly, even, like, kidnapping a baby. I'm like, oh, maybe you wanted a kid you couldn't have. Like, I could,
Yeah.
as fucked up as it is, I could kind of, like,
Find a way
to justify
to
it.
justify
This,
it.
I'm just like, what was happening
No
here?
justification.
Yeah, dude,
You know what I'm
there's
saying?
nothing-
Like,
yeah. Even there's a couple of cases, I don't know if you've heard about these, where like nurses are doing some crazy stuff. I don't remember what they're like given. They're given like some kind of medication to like send these patients into like asystole, and then they're like being the hero.
Being the
Oh,
hero.
Being the
yeah,
hero.
yeah, yeah,
Even
yeah,
that I can wrap my head around just a smidge. but
absolutely.
straight up breaking.
This
like,
is-
you're not doing the surgeries. You're not saving these babies. You're just being a sick individual.
Like, you're just a
bro.
sadist, bro.
Yeah.
Like, that's like,
Sicko.
yeah, like,
Oh
you're a
my
serial killer.
gosh.
Like,
That's wild.
That's insane.
That is true. I did hear about that as well too. Yeah.
Yeah, I'm telling you, every once in a while it'll pop up. Some crazy shit like that.
Wow.
Man, see, like, I feel like the worst I've heard from, like, nurses, like, we've worked with or worked in our hospitals, you just hear, like, with the fentanyl thing, they're just taking meds or, they're like, and again, that just comes down to a disease. They're probably, like, just drug addicts and stuff, and they just want to fix. But, like, bro, how do you get a fix from breaking bones
Babies,
with little
bones.
babies?
Yeah. It's heartbreaking. It's heartbreaking, honestly. And I think the last thing I wanted to ask you was, on the OB unit, have you ever encountered, I guess, a disengaged father who was at the bedside? I've heard of situations where, the woman's in labor and you got the father
Playing video games.
PS4 streaming, has the whole setup,
Yeah.
or making TikToks, whatever the case may be.
Yeah.
He's just not engaged. Like, he's asking for the Wi-Fi password just to stream some 2K.
Right.
Insanity.
Insane.
To me. But have you ever come across something like that?
It happens.
Really?
Oh, my
Probably
God.
more often than you'd think. Yeah.
Really?
Sometimes it's like a little more mild, where like I don't know. Some nurses on my floor are like, don't even bring the video game system in.
Fair.
Which is, you're
absolutely.
here for something else, but
Of course.
I don't know. I try to see the benefit of the doubt. Like, yeah, you might be here for a couple days.
True.
Not that they know that. You
Right.
know,
Yeah.
But sometimes you might be here for a couple days, or they use it as like a streaming service. You're putting on like Netflix or something on your PlayStation because you don't have a Fire Stick or whatever.
Then yeah, okay.
But no, sometimes it is crazy, dude. They're playing 2K or whatever.
Call of Duty.
While their significant other's pushing.
Dude, while they're pushing, but also like while there's like emergencies happen. Like, like the baby's heart rate is down and we're like, there's 6 people in the room like flipping this lady around, giving her a fluid bolus, giving like terbutaline to stop the contractions, like talking about a C-section, and this dude is like playing video games or like trying to sleep on the couch. Like, dude, can you guys like, we've had people say like, can you guys quiet down? Like, I'm trying to sleep. And it's like, this is a straight up medical emergency right now. Like,
Oh my God.
get off the couch and help us move your wife or
Absolutely.
Yeah.
your partner.
Yeah.
Like, get up.
Wow.
It's crazy.
It's a real
I
life
feel
thing.
like Ange would stab me. Yeah, right there.
Oh,
like
yeah.
she would get up out of that bed and just put something in my neck.
I believe
like,
it.
That's crazy.
Yeah.
I always thought that was like a social media, like people will post it on
No.
social media.
This
and
is
stuff.
It happens.
this is a real life
That's
thing, man.
nuts.
They'll have the headset on, talking,
Yeah.
and the people on the opposite end are like, "Bro, are you in the hospital right now?" Like, real talk.
You're on playing con. Like, nigga, are you having a baby right now? Like, why is there a baby yelling?
Is that a baby crying right now? Like, where are you?
That's crazy.
Yeah.
Yeah. I mean, I haven't seen anything like too, like pushing and on the headset. That's different. But yeah, definitely stuff like just not aware of like the situation or like not into it, like kind of there because they feel like they have to be and just not involved.
So, like, I mean, obviously that's always a horrible situation, but now that even, like, you're a father yourself, are you more like, dude, you have a role to play here. Like, play it. What are you doing?
Like in avocation, like.
You know what's crazy? I almost feel like because I'm a guy, I try to like help the dude out a little bit.
For
You know
sure.
what I mean?
100%.
Like they come in, dude. Even when my wife was in it, you're kind of like the scapegoat.
Yeah.
You're the dude that made this all happen.
Of course.
So even my wife was like, just annoyed with me.
Yeah.
So I level with dudes a lot. They come into like triage and like their wife or their partner doesn't have an epidural yet, and she's just like, sometimes you can't do anything right. You're trying to squeeze their feet. It's not enough. It's too much. It's you're trying to help out with stuff, and it's just like, I almost feel bad because I'm the dude in that situation that's like giving her the water or like helping out with like these comfort measures, and he's trying to help. I'm like, no, you're good, dude. Like,
Yeah.
same case for me.
Yeah.
I try to level with them, and
And sometimes I get it. It's understandable. It's your first child, new environment. You don't know what to expect and what to do in that setting. No, for real. In that setting, as a 21-year-old male.
Yeah, especially for the younger
You know what I
dudes.
mean?
Yeah, I didn't
It's
think
tough.
about that. I
Yeah.
didn't think
So
about
it's
that way.
like, okay, you're in a different environment, but at the same time,
Nah, I still don't see it, bro. I was at first. I was like, yeah, but nah, man. I just can't. I just feel like, and maybe it is because we're a little bit more grown, maybe. But I feel like I've always had this like innate thing in me where I'm just like, yo, I am a man. I have responsibilities regardless of where I am. Mm-hmm. I need to fulfill my responsibilities.
100%.
Yeah, it's tough when you're not in it. I think when you're in it, you can see it. Like even if they're being like young and dumb, you're like, oh, they're trying.
That's different.
It is.
That's different.
Yeah, no,
that's just trying, but not quite understanding what you have to do.
Yeah.
And that's different.
Yeah.
But like to just be like, nah, y'all got
As long as the initiative's there, then I gotta
Yeah.
respect that. But at the same time, if you know this is your first child, you're gonna be in an environment like the hospital, supporting your wife, take the time around the 7th month, 8-month mark and YouTube a little something.
Oh, for sure.
For
sure.
What's good, what you're gonna expect and what you're gonna see, because it's gonna be a shock. You know
Like
what I mean?
the only thing I could think of like as an example on like a med surg unit, we'll have patients that are, I don't know, like full feeds, and like their husband or wife will come in and like lunch is just like on the tray, and they're just like sitting there, and I'm like, yo, are you? And I'll set it up for them even.
Yeah.
And then I'll come back and like nothing's been touched, and I'll be like, yo, are you gonna feed your starving wife? You know what I'm saying?
Yeah.
And he's like, actually, this is something that happened recently. And the dude was like, no, that's your job. And I was like, big dog,
Oh my God.
your wife is going home tomorrow.
Yeah, man.
I won't be there. what are you going to do? She'll figure it out. No, you're going to figure it out, bro. Yeah. This is your job. This, I'm very,
cutthroat,
matter of fact and cutthroat. And I'll be in a conversation with people and they'll say some dumb shit. And I will come to eye level. I'll be like, yo, look at me. This is your job. All right? No one's paying you for this, but this is your role.
Yeah.
Like, this is now your job. You want your wife to come home? Big dog, you got to feed her.
Yeah.
Or she's going to starve and die. That's the alternative.
That's the outcome.
And I'm just like, bro, people just don't want to be there for their significant. And that's just mind-boggling maybe because, we're not those guys.
Yeah.
But I just don't understand it.
I think that is a positive that we can talk about, is that I think our generation, in general, more involved.
100%.
Not only in the fatherhood level, but on, the spousal level.
I agree.
I think we're more into, the caretaking stuff, whereas, the generation above us is, you make the dinner for me. What do you mean I'm making you dinner? I don't care if you're sick. Figure it out.
100%.
Mm-hmm.
They would rather sit there and starve than have to make a dinner.
100%, which is crazy.
Crazy,
and maybe it's because I feel like there is some stigma around it that women are just fed up, and maybe it comes back to that rise in women speaking up more. But I feel like I feel like when we had our kids, there was this stigma around men not wanting to do things and women being fed up with men not taking care. And I was just like, nah, I'm there. I'm waking up. Yeah. We're doing all this. And one thing I told Ange, I told her, you know what? For 9 months you can't drink, I won't drink. And 4 months in, we went to a wedding, and I was like, yeah, I don't think this is gonna happen. But other than that, I was like, yo, we're in this together. You are pregnant. I look like I'm pregnant. We got this. We can do this.
I see that a lot, and almost to a fault. People will come in and labor, and it's almost outdated now. But once you're past a certain point, or you're on a certain medication, or we see something in the baby's heart rate, we'll say all right, you can't eat anything anymore.
Yeah, it's
just clear liquids from here on out. Or even in extreme cases, all right, don't even drink anymore. You're on the cusp of a surgery.
Right.
Dude, we'll see dads that are almost a little woozy, haven't eaten all day, just like the mom. It's do you want a little apple juice, or you want a sandwich or something from the fridge? We can help you out. And they'll be like, no, I got it. It's no, dude, it was a suggestion, but for real, I can't tell. That's something that's I don't know. It's not fun, but it's always a good story. We always have dads hitting the floor.
Oh man, do you have dads passing out during labor and stuff?
During labor, during the delivery, during C-sections.
Oh man.
Well, we had a dad a couple of days ago, or not a couple of days ago. It's probably been months now. In a C-section, we thought it was just another dad passing out. This dude had a straight up heart attack.
Oh my!
Actually had a heart attack, and we respond to it so often where it's a nurse will call and be like, hey, the dad in my room is getting woozy. He's sitting on the couch, he's laying down, he just slid off the chair. Epidurals, we always make people sit down for epidurals. And this dude actually had a heart attack, and the go-to is all right, bring some apple juice into the OR, give this dude some apple juice. He's probably just feeling sick. Dude was they pulled him into the PACU, the post anesthesia unit that we have on our floor, and yeah, dude, luckily an anesthesiologist was walking past, and we were like, yo, we need you. This dude's actually out. He's for real. He just had a heart attack. And they started an IV. They ran some meds. They hooked him up to. Yeah, we have obviously EKG monitors in the PACU.
Oh my God!
This is just straight up at a.
That is crazy.
Yeah, it's nuts.
Damn. Can you imagine the kid growing up and just being a nuisance?
That's laughing. He had a heart attack, but that's
the dad is you almost killed me when you were born.
Oh my God.
Oh my God, that's a crazy one.
That is crazy, bro.
What happens?
Yeah. I guess to wrap it up now, what is something that you would tell your younger self or a male nurse coming into the profession who wants to become, an RN or specifically an OB nurse? What is something you would educate them on and give them advice on regarding that, based on your experience?
That part's tough.
So both, though. So advice you would give to someone wanting to come into being an OB nurse, and what you would tell your younger self.
Yeah.
Younger self, for sure. I touched on it just a minute, that I was raised a little bit more conservative, and just that gotta be a manly man kind of thing. I wish I could have just shook that off sooner.
Yeah.
Because it just, almost every aspect of my life, it was like, you gotta be a man about this. You gotta do this way, or you gotta be this, or you gotta be that, or I just wish I could have known sooner. Like, dude, be what you want to be. Why are you stressing about these social constructs when you could, have been interested in nursing sooner or interested in OB sooner? And not that it would have changed as much where I am now, but it could have. And it just sucks that I probably missed out on like not only like new relationships because I was caught up in that like masculinity thing, but also like building the relationships that I still have today could have been built on sooner if I would have like opened up about stuff. Even now, it's still tough. I had to have a drink even to have like this podcast because I don't like talking about myself. I don't like talking about the emotions, even though I'm so passionate about this field. Even just talking about the passion I have for it is difficult sometimes. And part of it's that you get asked it so often when you're a male in OB. Almost every person you come across in like the birth field will be like, wow, what made you want to do this?
Yeah, right.
At some point, especially when I first started, it was like, I just liked it. Like, all right, you're the fifth person to ask me this today. Like,
right.
I can't go through the whole spiel again.
Right.
No, I just wish I could have opened up more and been more in touch with just like who I am as a person instead of being somebody I probably wasn't at the time, you know?
Yeah.
Of course.
And then for new nurses or people thinking about nursing school or healthcare and OB and women's health, I just think, respect that it's a sacred space, If you're interested in it, don't be afraid of it, but also like know what you're going into and respect it for sure.
Yeah, I think that's key, a sacred space for sure.
I agree.
100%. Well, Anthony, man, thank you so much for being on the podcast.
Yeah,
you did
bro,
well.
Seriously.
Thank you.
I don't even think you needed the drink, honestly. You did well.
You did awesome.
No,
Seriously.
I think if I jumped right into it, I would have done well. But it was,
Yeah,
I also do enjoy a little Tom
yeah.
Collins.
You lingered a little bit. Hey, there's nothing wrong with that, man.
We had some great conversations, great stories, man. We appreciate it.
Yeah.
Absolutely.
No, if you guys ever get any feedback or you're like, I want to hear something different, I mean, there's the high-risk side of it. I feel like we touched on some social stuff. If you guys ever want to hear, like, high-risk stuff or, whatever, if you just think we could expand on this, I'm more than happy to come back on the
100%.
podcast. Dude.
Yeah, if you want to come
Absolutely.
back, we would love to have you back.
Yeah, I agree.
Even for something, I know my field, but if you guys are ever like, let's just have them sit in on one.
Yeah.
I enjoyed it. That's I told you guys before. It's what I like about podcasts. I like, there's a little bit of structure to it, but the conversation is just fun.
Yeah, I agree.
Yeah, I feel like a lot of women, not just women, but men will be engaged in this episode for
I
sure.
agree.
Yeah. No,
Yeah,
I'll try to put this out there more because I do. I'm on Reddit. I'm on, a couple other places where I just see like, there's a nursing subreddit. Every once in a while, you'll see a post pop up like, I'm a dude that's interested in OB, and like, is there anybody else out there that's interested in it? Like, they don't even know there's other dudes. So,
Absolutely.
I'm so happy to be able to link this podcast to my Facebook, to my, just to show people who I am and to, to link it to these other, I've even heard from people that have like moved from my unit to other units that are seeing like nursing students and stuff that are interested in it. I'm just happy to be able to give them this like small window into it because I was Google searching and I didn't feel like I really had it too much. So.
Yeah, right.
Yeah, like there
awesome.
wasn't that much resources out there on someone who's actually in it, right? So something like this, and this episode will actually shed light.
Yeah, I agree.
It's funny that you brought up Reddit because I think I'm actually on like a 30-day ban from like promoting the podcast.
Promoting the podcast.
Yeah, there's certain threads where you can't really self-promote. And I've been doing that a lot recently.
We're going to talk to Mr. Reddit, all right?
Yeah, whoever he is.
Yeah. Unban my boy.
Yeah, unban me. Unban the podcast. But no, once again, thank you so much,
man.
Make sure y'all like, subscribe, comment. Like I said, we need to get those subscribers up. We'll have more videos. Instagram, we're on Spotify, Apple Podcasts, TikTok, Facebook, all that.
Yes, sir.
Tell a friend, tell another friend.
To tell another friend.
Sir. So that wraps up the episode, and
Yes, sir.
we'll see you next time.
Peace.